Well, Florida's been a leader in tobacco prevention and reducing tobacco use among kids. It was one of the first states that actually used some of their tobacco settlement dollars to invest in tobacco prevention. Florida developed a highly innovative and highly successful Truth Campaign, which dramatically reduced smoking among Florida's kids, and that was exported to states around the country and eventually to the National Truth Campaign. Unfortunately, Florida's leaders decided to eliminate the Truth Campaign several years ago, and so Florida lost progress in its efforts to reduce smoking among kids. But in 2006, the voters took this into their own hands. They went to the ballot box and they demanded that some of those tobacco settlement dollars be spent on a comprehensive tobacco prevention cessation program, which has been in place in Florida now since 2007. Tobacco-Free Florida, the state's tobacco prevention cessation program, has really been successful since it started up in 2007. We've seen an 18% decline in adult smoking in the state, a 15% decline in youth smoking. That means we have 500,000 fewer smokers in the state of Florida since this program began. So it's highly successful, but what we know is we have to keep doing it. As soon as we back off spending on tobacco prevention, we lose our progress, more kids start, fewer adults quit, and that costs us in lives and healthcare dollars. The theme of Tobacco-Free Florida Week is saving lives and saving dollars. Since the Tobacco-Free Florida campaign started in 2007, we've reduced smoking in Florida among Florida adults by over 18% and among Florida kids by over 15%. That means we have 500,000 fewer smokers in the state. And what that means is we're saving Florida lives and we're saving Florida healthcare dollars. Not only is tobacco use the leading preventable cause of death in Florida and every other state in the country, but it costs us billions of dollars in totally preventable healthcare costs. We spend $6 billion every year in Florida treating tobacco-related disease, all of that unnecessary. When we reduce smoking, we save healthcare dollars. Experts estimate that we've reduced tobacco-related healthcare costs in Florida by $1 billion since the beginning of this program, and that will save over $5 billion in the long term just from the smokers that we've gotten to quit so far. Well, almost all smokers want to quit smoking. It's just that smoking is so highly addictive. And what we know is that if you get help, you're a lot more likely to succeed. So we would encourage Florida smokers to get help by calling the Florida Quit Line, which is 1-877-YOU-CAN-NOW, where they can avail themselves of free counseling, also reduced price medications that we know help people quit smoking. When you get some counseling and some medication, put those together and you get support from your social network, smokers are a lot more successful in quitting. They can also go to floridaquitline.com to find out more about how to quit. Every year, we still lose 28,000 Floridians to a premature death from tobacco use. 20,000 Florida kids become regular addicted smokers every year, and we're still spending $6 billion a year treating tobacco-related disease here in Florida. So while we've made some progress, we really have a long way to go. The biggest challenges in tobacco control are putting in place those measures that we know work to reduce tobacco use. At the state level, that means funding programs like Tobacco-Free Florida that are working to reduce tobacco use among kids and adults, but they have to be continued. It means increasing tobacco prices by increasing tobacco taxes, one of the most effective ways to reduce smoking, particularly among kids. And it means making all workplaces and public places smoke-free. When we put those three things together, that's when we get our most dramatic declines in smoking among both kids and adults. A critical element of a comprehensive tobacco prevention program are media campaigns, which educate the public about the dangers of tobacco, but also encourage smokers to quit and educate them about where they can get help. Combined with our community-based programs and that help for smokers who want to quit, we know these programs work to reduce tobacco use. The media campaign is a critical part of a comprehensive tobacco prevention program. And what we know is that emotional and graphic ads are the ones that get the most attention. In a very cluttered media environment, you have to pull people in with something. The evidence shows us that these hard-hitting ads encourage smokers to try to quit, but also get the attention of kids and help reduce youth smoking as well. Tobacco-Free Florida's hard-hitting media campaign is really a critical component of the program. We know it's working to encourage smokers to quit, and when they do, it's saving lives and saving healthcare dollars. But we also have a tobacco industry out there that spends $12 billion every year marketing these deadly products. We have to have a strong counter to that. The Tobacco-Free Florida program is so important because even after all these years, we have an industry that's still spending $12 billion a year marketing these deadly products, much of that aimed at our kids. They know that 90% of smokers start as children, and that's where what they call their replacement smokers come from. That's why Florida voters told the legislature, we want you to spend tobacco settlement dollars on tobacco prevention. The lives and futures of our children are at stake. Tobacco companies are putting a lot of their marketing resources in convenience stores now. They know that 75% of kids go to a convenience store at least once a week, and that's where their target market is. Tobacco-Free Florida is also working at the community level, all across the state, to create a healthier environment for our kids where they're less likely to start using tobacco. They're working to get rid of these candy and fruit flavored tobacco products which are so appealing to our kids. They're working on stopping egregious marketing practices of the tobacco companies to our kids, and also looking to get secondhand smoke at a multi-unit housing and other venues. A key part of that is involving young people and talking to each other. And in Florida, it's SWAT, Students Working Against Tobacco. They're the best deliverers of a tobacco prevention message. It really takes a comprehensive approach to reduce youth smoking. We know by reducing adult smoking, but also by making all of our workplaces and public places smoke-free, we're creating an environment that's healthier for our kids and much more conducive to them making healthy decisions about smoking. Well, it's critical that we not only reduce smoking in Florida, but we protect everybody's right to breathe clean air, free of the 7,000 chemicals in secondhand smoke. So that's why we need to make all Florida workplaces and public places completely smoke-free. When we have fewer adults smoking and all of our workplaces and public places are smoke-free, we've created a healthier environment for our kids where they're more likely to make good decisions about tobacco use. When we reduce smoking among adults in Florida, we're also making it less likely that our kids smoke. Children of smokers are dramatically more likely to smoke than those whose parents are smoke-free. So by helping smokers quit, we're helping them, but we're also helping their kids. Tobacco exacts a terrible toll on Florida families. A smoker spends a fair portion of their income buying cigarettes, but also the healthcare costs and other aspects of smoking, reduce income to the family. So when a smoker quits, not only does their health get better, but they save money, which they can be spent on more productive things for the family, but also they're going to be around a lot longer to support their family.